C difficile event reporting NHSN webinar. My name is Sarah Drenick. I'm going to quickly review a few housekeeping items before introducing today's speaker, Janet Robinson. The presentation slides will be available within a few business days, and you'll receive an email with a link. If you're not already joined on the WebEx version of this webinar, if you check the calendar invite that you all received, you'll find the link and passcode to join. We have muted all lines, and when we open up the call for Q&A, we'll instruct you on how to unmute your line at that time. Later, when we open up the call, please do not put your line on hold, as we can hear any music or recordings in the background. If you have a question at any point throughout the presentation prior to the Q&A session, please enter it in the chat panel to the right of your screen. Please make sure to send your comments to all participants, as we will be monitoring and responding to your questions and comments in chat. Lastly, if you find that the presentation is a little cut off, please use the plus or minus icon in the top right of the presentation window to adjust your screen accordingly. Next slide. Now let's get underway with today's presentation. I'm happy to introduce Janet Robinson. Take it away, Janet.
Good morning, everyone. On behalf of the New England QIN-QIO, thank you for your participation in the Nursing Home Quality Care Collaborative, and today a very specific thank you for participating in the Clostridium difficile initiative. March through December of 2017 are critical data entry months for this project, and we thought a short review of the webinar that I presented last November would be helpful. So please join me now as I discuss the difficile event reporting for NHSN. Over 2,400 nursing homes all across the United States have signed on to contribute Clostridium difficile data to the National Healthcare Safety Network. This will establish a database for the rates of Clostridium difficile in long-term care. And I want to give you just a little perspective on that number of 2,400 nursing homes. Back in August of 2013, there were only 130 nursing homes around the country enrolled in NHSN. In June of 2016, less than a year ago, there were 307 nursing homes. And now, in March of 2017, we stand at close to 2,400 or a little bit over, which is about 15% of all of the nursing homes in the United States. This is remarkable. And it is remarkable that so many nursing homes have waded through the NHSN process so that they can be a part of this initiative. This initial 10-month data collection period of March through December requires a strong commitment to accurate entry each and every month. Even months without any positive lab tests for CDIP still require data entry about resident days and admissions. All of these numbers are needed so that NHSN can correctly calculate rates. And remember, that's one of the great things about NHSN. You have to enter some numbers, but you don't have to do the rate calculations. NHSN is going to do that. So our objectives today are to define laboratory-identified LabID, it's called, event surveillance and reporting terms for Clostridium difficile, to describe how to enter the CDI LabID events in NHSN, and to describe how to enter the denominator or summary data in NHSN. Let's review the precise definitions used by NHSN so you know what to report and what not to report. The Clostridium difficile infection LabID event is what we want to report. And the definition of this is a C. difficile positive laboratory assay obtained while a resident is receiving care in the long-term care facility, and the resident has no prior C. difficile positive laboratory assay collected in the previous 14 days while receiving care in the facility. And a shorter way to say that would be the first positive test the resident has ever had report their first positive in 14 days. This is also called a non-duplicate LabID event. So, of course, we have a definition for what is a duplicate event, and a duplicate event is not reported into NHSN. This would be any C. difficile positive laboratory test from the same resident following a previous C. difficile positive test within the past 2 weeks, 14 days, while in the facility. I'm going to give you an example, and I'm actually going to go over this again a little bit later in the presentation because it is very important that you do not report duplicate events. So, let's think of a sample patient in the facility who has never had a C. diff test done before. A specimen is collected on March 1st, and that specimen does yield a positive C. difficile positive assay, so that specimen collection date of March 1st would be considered a reportable event. On March 6th, somebody sends out another C. difficile, and this one is also positive. This would be a duplicate event which should not be reported because it's only been 5 days since the first positive. On March 17th, somebody else collects a specimen and sends it out, and it is positive. Now, March 17th is 16 days from March 1st, but it's only 11 days from March 6th. So that March 17th test is also not reported. It is a duplicate event because it's only been 11 days since the last positive, which was on March 6th. On April 6th, there is also a specimen collected, which yields a positive result. That one would be an event, and it would be reported because it has been 20 days or more since that last positive test. Now, I've said all of this, and of course, one of the easy ways to avoid this is not to be sending out more C. diff tests than you need to. Some other testing information. Anytime you are reporting LabID events, it is reported for all of your units. You can't just pick one, say I'm only going to report for the second floor or the third floor. When you sign up your facility, this is going to be facility-wide reporting. You will be reporting the events based on what unit the resident is on, but you have to report all of the positive events for the facility. Lab results from outside facilities before the resident was admitted to your facility should not be included. And just a little further explanation of that. If a resident leaves your facility for less than 48 hours, goes to the emergency room, goes to visit the doctor, and the resident has a C. diff test done in the ER or at the doctor's office that is positive, that lab result would be included because the resident is still currently admitted to your facility. The key point here is that they were gone for less than 48 hours and returned to your facility. So that positive test that may have been done somewhere else would be reported, and you would report the location as the unit that they are on in your facility. It is helpful if you keep a log of your positive C. difficile test results with dates, and that will help you a lot in keeping track of duplicate test results. And just a reminder that C. difficile testing is done only on liquid stool samples. Toxin may be present in warm stool even after treatment, but without diarrhea, it is not considered an infection. And most laboratories now will not do a test unless it is on a stool that has assumed the shape of the container. Now, as I go on, if you happen to have a copy of an event form and a denominator form, you may find it helpful, but there will be screenshots, so even if you don't have a form, don't worry about it. Here is a picture of the event form. You should complete one form for each positive, non-duplicate test, and remember that's called an event by the National Healthcare Safety Network. The information on the paper forms must be entered into NHSN by the 25th of the month for the previous month. So any of you who have events for now, the month of March, those must be recorded in NHSN by April 25th. Some facilities choose to enter them as they happen, and some facilities choose to enter them all at once. And just as an aside, many, if not most facilities, are finding that they don't have any events or they have only one positive for the month. So it's probably unlikely, and we certainly hope that facilities aren't going to be having a lot of these to report. The events that are reported are going to become the numerator data for the NHSN calculation. As a reminder, only people with SAMS cards can utilize the National Healthcare Safety Network and enter data. There should be at least 2 users for each facility to help ensure that data can be entered every month. If you take a look at the picture of the event form, you'll see about halfway down the page that it asks for information about the resident type, short stay or long stay, as well as dates for first admission and current admission. And the next thing I'm going to do is review what those definitions mean. The date of first admission to the facility is the date that the resident first entered the facility. If your resident leaves the facility for more than 30 days and then comes back, that will change the date of first admission. And I'm going to make sure I'm going to repeat that. If the resident leaves the facility for greater than 30 days and then comes back, the date of first admission will change to the new date that they have come into the facility. From the date of first admission, short stay and long stay will be decided. Less than or equal to 100 days from the date of first admission is a short stay, and greater than 100 days from the date of first admission is a long stay. Excuse me. The date of current admission to the facility, this is the most recent date that the resident entered your facility. If the resident has not left the facility for more than 2 calendar days, then the date of current admission will be the same as the date of first admission. And I'm going to do an example of that for you. You have a resident who was admitted on February 1st, 2016. They are transferred to the hospital on June 2nd, 2016. And then they return to the facility on June 10th. The date of first admission is going to remain February 1st, and the date of current admission is going to become June 10th. Let's take a look now at the denominator forms. The denominator information is called summary data by the National Healthcare Safety Network. What you're going to need for this information is going to be the monthly totals for resident days, resident admissions, as well as the residents admitted on Clostridium difficile treatment. Resident days refers to the number of residents in bed that day. It does not include bed holds. Resident admissions includes admissions and readmissions, and residents admitted on Clostridium difficile treatment also includes admissions and readmissions. And what you're going to do is you're going to add up the daily numbers so that you get a monthly total for each of those categories. Depending on how data is collected in your facility, you may be the person who has to write these numbers down every day. In some facilities, it may be being recorded, or at least some of this information is recorded in the business office or in some other location. So you'll have to figure out if you're going to have easy access to these totals when you need it, because there's administrative data that you can just look at once a month, or you're going to have to figure out if you're going to have to yourself or designate someone to report these numbers every day. There is a form that is available to you from the National Healthcare Safety Network, and here's a picture of it. And in this picture, you will see arrows that are indicating the columns that would need to be completed so you would have the monthly data. And that, again, would be the number of residents, the number of admissions, and the number of admissions on CDP treatment. There is a newer version of this form which has another column related to the number of urine cultures ordered. Remember that for the Clostridium difficile project, you only need numbers for the 3 columns that are indicated with the arrows. When you are ready to put your numbers into the NHSN, you would enter the SAMS portal so that you can get into NHSN and put the numbers in. You're going to need your username, your password, and you will also need your SAMS grid card. And I want to say again about having two users. Last week, I attended in Atlanta NHSN training for long-term care facilities. During that training, they really very strongly suggested that nursing homes should have at least two users in addition to the facility administrator. That would actually be a total of 3 people who could access NHSN. When someone leaves a facility, or if someone is out on an unexpected medical leave, if there is only one user, it becomes very, very problematic to get someone else in place on short notice to enter the data. So we at the QIN-QIO are going to be speaking with all of our facilities to help make sure that there are at least 2, and certainly 3 would be better. A couple of other pieces of information from the training I attended. The NHSN suggests that for the ID that you need, that you use your first initial and last name. Also, email address that is unique to the user is really what is recommended. The generic email that sounds like dns@nursingHome.com causes problems when we have to change a user. So an email that says jrobinson@nursingHome.com is preferred. I understand that not all nursing home email systems are set up that way. And I want to let you know now that if it is necessary to change or to designate more users, there may be challenges in trying to reuse a generic email that is already established. So we would like you to think about using a personalized email as I described. When you have logged in, you will select NHSN Reporting. Once you have selected NHSN Reporting, before you actually get to put your numbers in, there are 2 things that need to be reviewed or that need to be checked, particularly if it is your first time entering data. When you first enrolled in NHSN, you established your facility location. That's the names of your units or floors, and then you matched them up with CDC descriptions. And that's the first thing that you want to do. You're not necessarily going to have to do this every time, but especially if it's the first time entering data, you want to make sure that the locations are already in place. So to do that, you use the navigation bar that's on the left side of your screen. You select facility, then you select location, and then you select find. And that's going to bring up a list of the units or floors in your building. If for some reason you didn't do this when you enrolled, you can click on the Add button to complete this step. If you have any questions or concerns about this, you can contact your state contact person at the QIN-QIO, and that person will be very glad to help you, and we will have a slide with contact information at the end of the webinar. Now, while we're looking at this screen, you'll notice that the screenshot of the location table on the left has a delete button. There might be instances where a unit or a floor is no longer going to be active in your facility and you want to remove it from the NHSN. That delete option will deactivate the unit for the future. It will not completely delete it because it may be connected to data that has already been entered. So if you do use that button, just be aware, although you will still see that unit listed, it will have been deactivated with the delete button. The second item to check or verify is that your monthly reporting plan is in place for the month that you want to enter data. You have to set up the monthly reporting plan before NHS even allow you to put your data in. You can set up your monthly reporting plan each month, or you can set it up for 12 months in advance. You would select Reporting Plan from the navigation bar, and then select Find if you just want to verify that the month is done, and you would select Add if you actually need to put the plan in for that month. And you can see that there is slots for you to put in the month and the year that you want to look at or that you want to add. please notice that there are 3 modules listed here. There's an HAI module, the LabID Event module, and the Prevention Process Measure module. For the purposes of this specific initiative, you only need to establish a plan for the LabID Event module. You can ignore the other 2 that are there. When you are setting up the monthly reporting plan under LabID Event module, you'll see that there's a space, you'll see the word location, and underneath it, you want to make sure that it says facility-wide inpatient, because that's what you're going to be recording. If you are new to filling in these type of forms, you'll see there are little arrows in the boxes, and when you click on those little arrows, that is going to give you your choices, and you select the one that you want to put in the box. Item number 2 is the specific organism type. You would be selecting C. diff for Clostridium difficile. And then that 3rd box that says LabID Events or Specimens, that one will automatically check once you have checked off in box number 2, Clostridium difficile. After you have entered the reporting plan for the month, you want to make sure that you click on the button that says Save, because if you don't click on Save, it's not going to count. If you wanted to set up your monthly reporting plan for more than 1 month, when the empty page comes back up, you would now enter the next month, and you can click on that box that says Copy from previous month, and that would save you a little bit of work if you wanted to put in more than 1 month at a time. Something else that I learned while at the training in Atlanta, the monthly reporting plan can be modified retrospectively, but you are not allowed to delete it if you have already entered data for the month. I am going to do one more review of which positive tests are reported and which ones are not. I'm really stressing this because if positive tests are over-reported, they're going to incorrectly inflate the rate of Clostridium difficile in nursing homes. And that's why it's so important to understand what a duplicate is. So please look at this chart carefully. You will see that on January 3rd, the resident had their first positive C. difficile lab test. This is not a duplicate, so yes, it would be entered as a CDI LabID event. If there is a second positive C. diff test on January 9th, only 6 days later, that is a duplicate and it would not be entered. If there is a positive test on January 20th, this is also a duplicate because it is within 2 weeks of that positive test on the 9th. Same thing holds for a positive test on January 29th, because that is within 2 weeks of that positive test from the 20th. Now, pay attention very closely to what I'm going to say next. If you were to go into NHSN and try to enter the January 9th event, the system will reject it because the system knows that there was a positive test on January 3rd. But if you were to try to enter the January 20th event, the system will accept it because as far as the system knows, it's been greater than 14 days since January 3rd. We have to be smarter than the system, and that's why I encourage you to keep a log of positive C. diff tests so that you are not entering a duplicate event. Using your paper version of the event form, now you're ready, finally, to enter that data into NHSN. From the navigation bar, you would select Event and Add, and then it's basically a matter of transferring the information from the paper form to the form that is on the screen. If you have any questions or problems the first time or the second or third time you try to do this, your state contact will be very happy to walk you through data entry until you feel comfortable doing it on your own. Resident information is entered first, and there are asterisks to show you what is the required information. After you have entered the resident information, you're now going to be putting in the event information. Once you have entered the event type, the LabID MDRO or CDI event, or the CDI event, You're going to enter the specific organism type of C. difficile, and those next two slots of specimen body site and specimen source, they're going to fill in automatically for you. You put in your resident care location and the primary resident service type, and then you have a couple of questions about the resident and if they have recently been transferred from an acute care facility. These are very important in helping NHSN determine some of the categories for the positive test. So has the resident been transferred from an acute care facility in the past 4 weeks? Please make sure you appropriately put in yes or no. And if the answer is yes, put in the date of last transfer from acute care to your facility. And the additional question is, was the resident on antibiotic therapy for this specific organism type at the time of transfer to your facility? So when they were transferred in, if they were receiving treatment for Clostridium difficile, you would put a yes there. Now, the next questions here, I got a little information about this when I was in Atlanta also. This says documented evidence of previous infection or colonization with this specific organism type from a previously reported LabID event in any prior month. You don't have to put anything in there. You're just going to leave it blank and NHSN is going to use it. But they told us that because they saw some retrospective information, data from the resident from previous months, you may see a date in there or you may see a yes in there. The instructions from NHSN said, leave alone whatever is there. You're not going to be able to change it anyway, so don't waste any of your time or energy trying to change whatever you see in that box. It's being used in the background by NHSN. The next two blanks there where it says custom field and comments, you don't have to put anything in there. Those are optional categories. Some long-term care facilities may decide that they want to use them internally, but there is nothing you have to do there. Something else they said during the training, there is at least one facility, one nursing home in the United States who has specialized in these categories so that they can enter for patients who have a positive C. diff test. They can enter what antibiotic or antibiotics the resident is taking currently or have been taking recently. So eventually they're going to have some data to look at, are there Clostridium difficile events related to specific antibiotics. And I'm only mentioning this because as we all move forward with antibiotic stewardship, that would certainly be an interesting application as we get a little more proficient at our antibiotic stewardship program. But that can be put down the line. For right now, you can just leave those blank. Once you have entered all of the event information, you want to review the slide. And of course, you want to make sure that you hit save. And you're going to get an event number. Write down that event number because that's going to make it easier for you to go back in if you needed to edit any information on the event. Now you can use your paper denominator form so that you can enter your monthly summary data. At the end of each month, you're going to enter that monthly information into the NHSN application. You would locate summary data on the left-hand navigation bar, and then you would hit add. You're going to enter for your facility ID will autofill, and then you're going to enter the month and the year for the data that you want to put in. This is what the page looks like in the NHSN system. You are only going to be entering numbers in that middle module called MDRO and CDI LabID Event Reporting. Remember, you don't have to be concerned about the other modules. Here's what it will look like when you complete it. And you're going to see that there are numbers filled in for resident admissions, for resident days, and for number of admissions on Clostridium difficile treatment. This summary data is entered even for months when there are no positive lab tests to report. The data calculations that NHSN does will not be accurate unless they have denominator or summary data for every month, even if you did not have to enter any events. And notice that there's a list that goes across of a lot of different organisms. The one that we're concerned about is Clostridium difficile, and there will be a check in that box to help show you where it is. If you did not have any positive lab tests for the month, there's a box there that says Report No Event, and you would check off that box if you did not have any events for that month. When you go into NHSN, especially after you've entered data for several months, perhaps there's a month where you forgot to do something. Well, they're going to let you know that you forgot to do it, and instead of saying, oops, you forgot, it says Resolve Alert. And you'll see they actually tell you what things are missing, and these are hyperlinks. You'd be able to click right on that where it says 5 missing events or 3 incomplete events. You'd be able to click on it, and it would bring you right to where you need to make the correction. The most common issues with your issued an alert tends to be for missing summary or denominator information for the month, or it can be related to not checking off that box that says Report No Events. And just a little bit more information about reporting no events. If you have already entered LabID Events for the month before you go in to do your summary data, the Report No Events box is actually going to be disabled, so you're not going to be able to check it accidentally if you did already enter an event. Supposing you put in your summary data, you checked off Report No Events, and then the next day you realize that you did have an event and you had forgotten to put it in. That's okay. You can go in, you can put in your event, and the Report No Events box will automatically uncheck. And here is a review of the review. When you are putting in your data, you want to first make sure that your locations have been mapped. You want to make sure that the monthly reporting plan is in place. All of your C difficile LabID events need to be entered by location, the unit or floor that the patient is on when the specimen was collected. And you want to make sure that you enter your denominator data, called summary data, for each month. I probably should have moved Resolve Alerts up to right under Review Monthly Reporting Plan, because generally you're going to see that page before you can enter your data, and you want to make sure those things are resolved so that you have all the data in correctly. Entering the proper specimen collection dates allows NHSN to categorize the Clostridium difficile as an incident event or a recurrent event. An incident event refers to a positive test from a specimen collected greater than 8 weeks after the most recent CDI LabID event, or it is the first LabID event ever entered for the resident while in the facility. So that's an incident event, the first time it happened, or the first one in 8 weeks. A recurrent LabID event is something that has happened greater than 2 weeks since the last positive test. It's entered greater than 2 weeks and less than 8 weeks after the most recent LabID event. And a recurrent CDI LabID event is probably tied to the incident event, maybe an infection that hasn't completely cleared. But the NHSN will determine those 2 categories for your CDI LabID events. When the NHSN combines specimen collection dates and admission dates, they can now take your CDP positive event and determine, did the event have its onset in the community or in the long-term care facility. So a community onset event is a specimen that was collected less than or equal to 3 calendar days after current admission. Another way of looking at that would be a specimen that is collected on day 1, 2, or 3 of that patient's admission. A long-term care facility onset event refers to specimens that were collected greater than 3 calendar days after current admission. So that would be anything on or after day 4. That category can then be subdivided, and this is one of the things I like very much, and I've said it several times about this NHSN program. There's another category that's called acute care transfer, long-term care facility onset. This refers to a positive LabID event with the specimen collection date less than or equal to following the date of last transfer from an acute care facility. So those of you who have said to me, or in conversations we've said, well, I know that C. diff started here, but they were just in the hospital on antibiotics. That's what this category is going to cover. So it will show that although the C. diff may have activated in your long-term care facility, the seeds for it were sown during that previous hospital admission. And that's why on those event form questions about has the resident been transferred and the date of the last transfer, this is why it's so important to make sure that you fill those in. I'm having a little trouble advancing my screen. Oh, there we go. If anyone is interested in the full detailed training sessions on the Centers for Disease Control, I did provide the link here for you. And while you're asking your questions, and you can answer, put questions into the chat room if you would like, I am also going to put up for you the list of the contact list for each state so you would know who to contact after the call. Do you have any questions in the...
To join over the phone and ask the question, just dial #6. And again, like Janet mentioned, you can also enter your question in the chat panel to the right of your screen. We do have a question in chat from Laura. The hospital can perform lab testing on formed stool, and we have seen signs and symptoms of infection with no loose stool. And upon ER testing, C. diff has been diagnosed. If they go to the ER and return within that 24-hour period, should we report this C. diff or no, because it was with formed stool?
Well, that's a fantastic question. The criteria for the NHSN initiative calls for unformed liquid stool, not for formed stool. It does meet the criteria that it was done in the ER and the patient came back to you. I will be happy to submit that specific question to the NHSN help desk to verify that I am correct, but I think that because it is not on unformed stool, I don't know that they're going to want that result. And I am surprised because most hospitals will not be performing it on unformed stool. So, Laura, if you want to email me at jrobinson@healthcentrisadvisors.org, just to remind me, but I'm going to try and do that today, I will send that question to the NHSN help desk and then share the answer with you, and I will share it with everybody, in one of my weekly emails. I just don't want to give a definitive answer until I double check with them.
Hi, Janet, it's Laura.
Hi, Laura.
So, thank you for that answer. It's just one of those funky things that we've seen with C. diff as it starts to change. But I also had another question, if you don't mind, in regards to the summary data. The number of admissions on C. diff treatment, if there's no lab event to report, meaning none of the current C. diff that may be treated in the building meet those requirements, would that number still be 0? My confusion is, those admissions that come in already have been tested in the hospital. They come to us with an active C. diff infection, and they're already being treated. My understanding is that's not a reportable, therefore that number would still be 0. I just want to make sure I'm doing it correct.
So, Laura, the question that's being asked is, are they arriving on C. diff treatment? And if they are arriving and they're taking an antibiotic to C. diff, then they do count. The question isn't about their test, it's about treatment. So they will not count as an event for you because their testing was done in the hospital while they were an inpatient there. But if they arrive and they're taking the vancomycin or whatever, that would count as they're on treatment. Does that clarify it?
Yes. Thank you.
Again, to unmute your line and ask a question, dial #6. We have another question from Patricia. I missed the first part of the presentation. Is this available on the NHSN site so I can review the first part? So we will be sending out a link to the presentation slides a few days, within a few business days. We also noticed that a few slides were missing some text. There must have been an issue with it being uploaded into WebEx, so all of you will get a copy of the presentation, especially if you were only able to join over the phone and have access to the slides. So keep a lookout in your email for that.
And remember that I did show this on one of the, let's see if I can just go back here on my slides. I'm doing a review of a full training that I did in the fall. If you want the full version from the Centers for Disease Control, and I'll just put that slide back up, you can also go directly to the CDC website and get a very, very full version of LabID Event reporting.
Make sure if you're sending questions in chat that you send questions to all participants. I did receive a private question in chat, and that question is, when do I need to enter my monthly data, and what if I'm unable to enter it on time? Can I have someone else go in for me?
The data needs to be entered by the 25th of the following month. So we are now in the month of March. March data needs to be entered by April 25th. Only people who have a SAMS card can utilize the NHSN system. So if there is only one person in the facility with the SAMS card, that is the only person who can go in and enter data. I know this gets confusing and seems difficult, but you have to remember that the Centers for Disease Control, NHSN, we're talking about a federal data system, and that's why they require identity proofing before people are allowed to access the NHSN. This is also why it's so important to have more than one person with a SAMS card in each facility.
Hi, it's Laura again.
Well, is this Laura? Where are you calling from?
Riverview.
I thought it was you. I just wanted to be sure. Hi again.
Yes, hi. We haven't had much to report, so that's why I wanted to join today, because I wanted to, firm up if we do have anything.
Right.
Recently changed administrators, and my current administrator has a SAMS card and an account, but she's on another nursing home. There's a process, if I email you personally, that we can go through to adjust that, correct?
Yes. Yes. If you want to call me
I'll
after,
email you.
And it's really a matter if you can get the previous administrator to go back in and designate you as the administrator. That can be done.
Okay.
We don't have any additional questions in chat. Do we have anyone else on the line that would like to ask a question? To unmute your line, dial #6.
If there aren't any questions about data entry, if anyone has questions about anything else related to the initiative, we'd be happy to take those too.
Hello?
Hello?
Hi, it's Kathleen Gilmore. How you doing? It was a great presentation, by the way.
Thank you.
One of the things that I think is helpful, I don't have the number of the slide, but the one that shows the dates and whether those dates are actually a LabID event or not, I think that's a really helpful slide, and it's almost worth it to have actually recommended to folks to actually print that off and have it in front of you, because I just think it's a great tool. That one.
Is this the one you're talking about, the knowledge?
Yeah.
Up again.
Yeah, I think it's really helpful to have that printed in front of you, and so, especially when you're first getting used to, doing the data entry and determining what's an event.
I agree. And I don't want any nursing home to be over-reporting their events. And especially when you think about the national baseline that's going to be established with this data, and from that national baseline, I'm sure there's going to be suggestions, toolboxes, toolkits, things that are being produced for nursing homes. Let's really accurately report how much C. diff there is in nursing homes and not over-report it.
And I do have one other question. I've been getting calls from people that they really don't understand how to determine resident days. So can you just clarify that for folks?
Resident days, if they want to use that denominator form from the NHSN, for each day of the month, they enter how many residents are in the building on that day. And then the monthly total, so if there are 30 days in the month, they add up each of those numbers, and that's how they come out with their resident days for the month.
So say hypothetically they had 100 residents each day of the month, and it's a 30 days in the month. You would do 30 days times 100, give or take if there was 99 the next day or 101 the day after that.
Thank you. I hope that clarifies for people that have that question.
Sarah, this looks like this is not the correct contact slide. I just looked at it. I'm going to apologize. The contact slide that's up is related to our antibiotic stewardship collaborative, not to the C. diff collaborative. I don't know. Oh, I'm sorry. There must have been additional slides. I have the correct slide up now. I guess there were some additional slides on this that we did not see initially. I have the correct slide up now for your CDI contacts.
We have another question in chat from Christine. Is there any way we can get data analysis for QAPI and Joint Commission? Christine, can you clarify what type of data you're looking for? Are you trying to get the data that's being entered into NHSN? If it's helpful, we can send some data being entered in NHSN. Okay, so you're interested in getting data analysis for the NHSN data that you're putting in so that you can utilize it for your QAPI program and to use for the Joint Commission.
Within the NHSN system and available to you will be data analysis reports. It is suggested that you collect data for at least 6 months before you begin to run those reports. Actually, one of the next steps or parts of our education process for this will be to familiarize our facilities with the data analysis reports. If you are computer savvy, you could go in now in the NHSN system when you log in. I just wanted to bring up one of the slides where you see where the navigation bar is visible on the left, because you can begin to look at that now, because there is a subset under the navigation bar that says analysis, and when you click on that, there is some information there about how to get started. It involves generating data sets where you would enter the dates of the data you want to look at for your facility, and then once the data sets have been generated, it can prepare a variety of reports for you. I would mention, if you're going to, again, you really have to have data in there before you can do anything with it, but I would stress that when you do that, you have to generate data sets each time you go in. So if I were to go in and I put in dates that covered January 1st through March 31st, and then I were to go in 2 weeks later and want to look again, it would not auto-populate. I would now have to change my date from January 1st to April 15th if I wanted to get more information. So you do have to do those data sets each time you go in. I don't know if that's helpful to you or not, but the short answer is yes, you will be able to get data.
And we can send out along with the email that will include the PowerPoint slides, we could include some materials from NHSN that kind of walks you through how to do that. Do we have anyone else on the line that has a question?
If there aren't any other questions, we would like to thank you very much for participating. And just as a wrap-up, I am going to follow up with the NHSN Help Desk about the question about the testing that was done in the emergency room, a positive test, but it was done on form stool. Again, my inclination is that because it was not done on unformed stool that they are not going to want it, but I will follow up with that. One last call for questions. We would like to thank you very much for participating, and I hope that this information was helpful for you. And remember, please enter your data every month because these next 10 months are very important for establishing that national database. Thanks for attending today.